Spinal cord injuries impair patients' ability to cough and clear their lungs. As a result, SCI patients often experience respiratory infections with over 38,000 complications per year. This is a serious problem.
We developed a patient-operated mask that provides positive and negative air pressures, effectively stimulating a cough. The device can also dose a large volume of aerosolized drug, reaching the lower respiratory system to effectively fight infection.
Over 300,000 Americans live with spinal cord injuries today. 13% of them will experience respiratory infections each year, leading to $2.5 billion in medical expenditures. We estimate the immediate market for patient-operated cougher as $350 million a year.
We strongly believe our device could dramatically change the quality of life of spinal cord injury patients.